welcome back to the Hefflinger Podcast. Today we have a very special guest. We have Bob Baxter, who is the president of Mercy Healthcare System for the Toledo, Ohio market. Mercy is the largest healthcare system in Ohio, and it's the 5th largest Catholic healthcare system in the United States. In his free time, Bob loves to run and has completed numerous marathons, which we'll discuss today. He also completed the Sylvania Triathlon with us last summer, and some of you may have seen him on our social media. But we're super excited to have you here today, and excited to talk about some things.
Yeah, we've been looking forward to this for a long time.
My dad and Bob are both very busy guys, so we've been working to get this on the radar.
He's actually my boss.
I just do what Dr. Hefflinger tells me to do. That's my secret.
But so I think to start from that was just kind of my thing of like what I know about you and just stuff I could find. But why don't you kind of describe maybe what a day-to-day looks for, like what you do on a day-to-day basis or a week-to-week basis. I don't know if day-to-day is the best, but just give an overview maybe.
Yeah, I'd be happy to. But first I have to thank both of you guys for challenging me to do the triathlon in the first place. So I think there's a saying, if you want to go far, go with others. If you want to go fast by yourself. I definitely didn't go fast, but I went far because of you guys. So
was that your first,
I got it done.
Was that your first triathlon?
That was my first triathlon,
wow,
possibly
amazing.
my last.
No, not at all.
For those who don't know, we did the Sylvania we did the Sylvania Olympic triathlon last year, which it's a little under a mile swim. It's a 24.6 mile bike, and then it's a 10K, which is 6.2 mile run. And it's called the Olympic distance because that's the one they do for the Olympics. But it's not.
So you got to let me tell this story because I really, because you guys challenged me to do it and encouraged me to train and made it easy and risk-free. But I was the worst swimmer at the triathlon. I came in dead last, and I was probably, 100 yards into the swim and ready to get out of the water. Yeah. And the guy who was supporting the event on the body board said, I don't care how long you take. I'll stay with you as long as it takes for you to finish it, whether you dog paddle, back float, or anything else. And I did it because he was there and was supportive. And so
but
it was
don't let him fool you, because I remember, so I did this one pretty quickly, and I got on my bike, and Bob almost caught up to me on the bike. And then when the running came, he flew. He's an excellent runner. So really, the times were about the same, honestly. It's just that we all have our strengths, and we all are,
I'm not. You're pretty, for your age group, you're very good. You're usually in the top, like 4th.
10%.
Yeah.
So. But for biking, I'm not that good. Like I always fall behind on biking. Your biking was good.
I think I had the tailwind though when I was biking. I think you didn't have the tailwind.
Swimming's definitely like, people doing triathlons and Ironman, swimming is like 90% technique. So if you don't, like, for me, I'm not great at swimming comparatively to my run and bike, but it's because you can try as hard as you want if you're don't got all the technique from hundreds of hours practicing. It's really hard to go fast.
It is the perfect example of, it doesn't matter how hard you try that day, if you didn't put in the time in advance, you're not gonna
my first one, I think it's because I know the swim's always the most intimidating thing for, I think, a lot of people when they do triathlons. I remember my first one in 2019 when I was doing it. I just stopped because you're getting kicked sometimes and lots of people around you. I just was doggy paddling, or not breaststroking for a bit, because I know I can breaststroke as much as I want.
Well, I think the hardest thing I've noticed, when you start to swim, no matter what I've done quite a few of them, you're always hyperventilating at the beginning. I don't know if you guys notice that. Like, you're hyperventilating, you have to slow, you're breathing down, and then you get into that rhythm. Once you get in the rhythm, then it's fine. But it's hard starting out. I mean, people are all around you kicking, and you're hyperventilating, you're breathing fast, and it's really hard to calm yourself down. Yeah.
Do you remember they changed it too? Because we did the 2023. It was beginning of August or end of July. It's always right around then. They changed it so you literally they spaced it out more. So we were waiting for we were on that beach. I remember waiting for all the sprint triathlon people to go. So that's what I hate the most about races of any sort. I think marathons are the best, but triathlons and Ironmans are the worst. You have to sit there for like 30, 40 to an hour plus, and I don't know. It builds up the anxiety where you're like, once you're going, you're kind of getting the rhythm.
Well, I will say, even though I was terrible at it, I probably was never in better shape because I trained for things I didn't typically train for. Yeah. So just, stressing your body in different ways.
No, but what was cool about what you did, I think, is that it's something that you've never done. And I was happy when you said you would do it, because I never thought you would. But he went and took swim lessons and practiced swimming because he knew that was his weak point. And there's something to be said about that. Doing something, taking your worst thing and working the hardest at it, which is what I think you did. You put a lot of time and effort into it.
I think something too is just like it's always fun to be just good at things you're good at, and then just like you're saying, not focus on anything you're not. But it's always the most growth when you go with a beginner's mindset and try new things. Where I think it's fun to switch things up instead of you can be easy to get in a routine. I think if you run 3 miles every day, say 7 days a week, eventually your body's used to that. You got to put in like some yoga or weightlifting or bike or something. Yeah. It's a good switches up the stress on your body too, instead of being one repetitive thing.
But anybody out there, you should try. Just start with a sprint triathlon. It's good for your body and your mind, and I think you would enjoy it if you're like to do outdoor type of activities.
Yeah.
Can we start? I'd be interested just to start with is I'd just be interested to how you got to your position. I mean, you're a pretty big position that most people won't obtain, and so how did you? What did you study in college? Like, how'd you go about it? A lot of people, like in my career, ask me, what'd you do? Where'd you go to college, or what did you do in college? So maybe just take us through that path of it.
Yeah, I'd be happy to. I mean, I think there's a lot of people who'd like to know how I got in my position because they're not quite sure I should be there. And definitely a lot of luck has something to do with it too. But, the path I took, I was very fortunate. So, like a lot of people I know, they're shaped by their parents and my mom and dad. My mom was a teacher, my dad was a farmer. So, every day after school, every weekend, we worked hard. And so that was a good work ethic. And then I definitely married up, and my wife pushes me hard to, do better, work harder, try harder, and achieve more. So that's definitely been a big piece of it. And then I've had some great mentors along the way. And, there's 3 people specifically I think about who, from each of them, I took some lessons that helped me grow as a person, not just as a hospital executive, but as a person. So I've been very, very fortunate that way to find the right people to talk to and to be part of my life. The other thing is, that's probably a little bit different from other folks that you may run into, is this was a second career for me. So, I was depending how you want to tell the story, but, I was a failure at my first career. I sold electrical outdoor illuminated signs, and to all these companies that have since gone out of business, like Kmart, Walden Books. I think Super 8 may still be in business, but that was one of the folks we worked with. So when I say failed, it wasn't that I wasn't good at it. I just didn't find any satisfaction in it. Yeah. I didn't look forward to, I spent all week looking forward to Friday. I spent the days looking at the clock, and it was probably the best.
How old were you when you?
I was right out of undergraduate. Okay. And it was a wonderful opportunity that I was very fortunate to get. It was
so early 20s.
Early 20s, yeah. I was 21.
Yeah.
21.
Yeah.
It was my best friend's dad who had the company and said, "I want you to come work for me, and we're going to start you on the sales floor and then do some other things." And I learned some really important skills. What's the ABCs? Always be selling. Sales, no matter what you do, kind of whatever role you're in, it's important to kind of understand that skill set, and it helped me a lot. It also helped me understand that the things that I took pleasure from and satisfaction from, the things that I didn't want to do. So it motivated me to find a different career path and be a little more purposeful about it. And so worked well for both my wife and I. She went to law school, and then I ended up talking to some people. I didn't have healthcare in my background. No one in my family had, other than being a patient, had any experience with healthcare. But I had a chance to visit with a lot of people in the community. It was a small town, so a lot of people were accessible, and it just felt like that was the right place to go for a lot of different reasons. And luckily enough, you get to work with people who, I think people get into healthcare because they want to help other people. So I mean, it's so gratifying to be surrounded with people like that every day. I mean, it's like all the different frustrations and issues that you go through because it's a complex system, and there's always going to be different things that could be done better, but you're surrounded by really smart people who want to do things for others.
Did you do an MBA? So you finished college, and then did you do an MBA, or
Yep.
What did you need to do?
Or an MH, is it masters?
I did both.
Yeah.
I did both. Yeah.
Where'd you do that at?
So somehow I convinced the University of Iowa to let me in. So they let me into both their MBA program and their MHA program, and I did a dual degree. I had a business undergrad, and I do enjoy business, and I thought that was the aspect of healthcare I really wanted to emphasize. So I went through the MBA program. The MHA side was new to me, and so that's where I did most of my learning. Iowa has a terrific program, always has had a terrific program, so the opportunities coming out of there were good. So I did have one really lucky period of time there where they had a fellowship, or I should say an internship, in the West Indies on the island of St. Lucia.
Oh, wow.
And
that's sweet.
Because I was doing a double master's degree, I had an extra half a year, which meant I had an extra summer for an internship. And so I thought, I'm going to see if I can get this one. And I got it, and I was excited. And they said, well, you were the only one who applied for it. So we really didn't have much
it's better
choice.
just not to know that.
So you went? So you went?
Of course.
Nice.
Yeah. I've been back several times.
How old were you at that point in time? Around?
Yeah, probably 24, 25, something like that. Yeah.
And what would you say, like, I feel like that's a lot of people, I mean, whether in college or undergraduate and beyond, I think there is a lot of uncertainty. You're kind of forced. When you first go to college, you try to pick a major. I think a lot of people switch and other stuff. It's like that when you get out of school. I feel like it's easy to get into a job, and then you kind of find out I don't like this that much. And then what do you think? What were your thoughts around that, and what kind of made you take that ultimate push where you just knew I need to try something else, or I don't want to do this?
You're changing your life. You basically change your life. You decide.
We were talking to Bill Gestalter, one of my dad's friends, and that was kind of a similar thing later in life where he was at, I think early 30s, but just having to make a change. And I mean, I think a lot of people don't ever make that change because it's really hard to get, when you're so used to something, to then take a complete leap of faith into something new.
Yeah, I mean, I was fortunate in that, I had great family support. At that young, tender age, early 20s, that I had a lot of opportunity still to kind of make decisions that, if this wasn't the right one for me, I could still make a decision without impacting my life detrimentally. And as you call that out, I think, here locally, I think about like junior achievement and what Jim Pollock is doing with junior achievement to create what he's calling the 5th year program. So, kids coming out of high school who don't know exactly what they want to do or haven't experienced enough of life yet to make an informed decision about their career can have kind of this cooperative mentoring, shadowing type of experience. I wish that was available for everybody. I wish I'd had a chance to do something like that. It would have saved me probably years of debt and years of lost, opportunity. But, that all said, it was the realization that, I didn't see a future in doing what I was doing where I was a happy person or a person that was going to be someone you wanted to be around. And that secondly, it was still early enough that I could make a different decision. And like I said, when I say I'm married up and I've got a wife who pushes me, I mean, she was my fiance at the time, and she was one who pushed me too, kind of gave me the courage to say, I'm not happy with what I'm doing. I want to go back to law school. So definitely doing this with someone else was a big part of it and kind of help support each other along that journey.
Is your wife a lawyer?
She is. She's as we joke, she's a recovering attorney. As she made a decision after we had our twins that between daycare or raising the family, she sacrificed the career side of it to raise our children.
Yeah, same as my wife Cindy. I mean, she's so.
Well, you just did a newsletter on that.
Yeah, I know that.
So what did Cindy do? I didn't know.
Cindy was a forensic pathologist.
Oh, okay.
Yeah. So she had a big career. I mean, she has an MD, PhD, so she spent a lot of years in school, 3 years doing her PhD and 4 years of medical school. But, we had that conversation after our 4th child. I mean, I was busy starting my practice here in Toledo, and, I was a neurosurgeon. I had to be gone a lot. And here we got 4 little kids, and we had nannies at first and babysitters. And we got to the point, do we really want our kids to grow up like this? And so Cindy, I didn't push her. I said, whatever you want to do, Cindy. And she wanted to, make sure the kids had a mom. It had one parent there all the time. And, she'll remind me of that every once in a while that, I gave up my career for all this. And I understand that, Cindy, but, we talked it through and this is what we decided to do. And it has its perks too. I mean, it's very stressful being a mother, but there are times where she can have some time to relax and not, be at work stressed out. So But yeah, same situation.
I think too, like she was saying, is it's very rewarding raising kids, but it's also for her, I think she felt guilty in a lot of ways, like when she's working and then someone's at home. So I mean, yeah, I think it's a
well, she
big
feels
decision.
like she's talked to me like I wasted all that education. I spent all that time, building a career and all that education. Now I don't use it for anything, which, is a good point to that.
But she does, because that's when I grow up and still now, when I was growing up and still now, whenever my dad and mom are talking about stuff, it's always with lots of medical terms. My mom still is very sharp with all of her medical knowledge and likes to debate stuff with my dad. Doesn't she?
Yeah.
So.
Well, and you always want to grow, personally and professionally. And I imagine that made for rich conversation at home and probably, a richer environment to grow up in too. Yeah. But yeah, those are difficult decisions,
So what was your first job in the health system then, or in health care? Like, so you did your MBA and your schooling, and then what was your first position into the medical field?
It was in Kearney, Nebraska. So
where?
Yeah, it's a wonderful place. It's not a place a lot of people have been to. Kearney, Nebraska. Huh. So and the quick story about that is my best friend and I were both interested in the same job. This internship was a 2-year residency in Kearney, Nebraska, which was a Catholic hospital, kind of in the middle of the state, about an hour west of Lincoln, Nebraska. So just to put it in context, right off the interstate. And so we went down there together. We interviewed at the same time and then compared notes on the way back. So we just wanted one of us to get the job out there. So I was fortunate enough that I got it. But and the key to me was it was a great health system. Later, like right after I got there, it became part of Catholic Health Initiatives, which is now Common Spirit, and that's the largest Catholic health system in the country. But I say that because it also opened up a lot of doors earlier in my career to be lucky enough to be with a small enough health system that I got to do a lot of different things. And they committed to 2 years, which not everybody does. If you get a 1-year residency or a 1-year fellowship, you're 6 months into it and you're looking for a job rather than focusing on learning everything there is to learn. And then when they became part of Catholic Health Initiatives, it just opened up a lot of other doors based on the size and scale of the system. But then 5 years there, and then after that, so I just did different support services out there. I was wet behind the ears. They gave me the things they thought I could do the least damage on. And after I did some of that, my CEO went to another Catholic Health Initiatives hospital in Lexington, Kentucky, and he asked me if I'd be interested in going to Kentucky with him. So ended up in Lexington. That's kind of where my career started. So just given a lot of great opportunities to do different things there.
Yeah. When did you take up this position that you're in now?
So in Toledo, I started in 2017. And so, as you know, Dr. Andrabi was the market president here, and I was in the same role in Lima, so we were peers. And then when he left to go to a health system in Wisconsin, I was given the opportunity to come to Toledo and lead up here. It's interesting, though. There's a small world story here too. At one point in my career, and I'll throw out a name, I had been recruited by a recruiter in healthcare that a lot of people know by the name of Carson Dye. And he recruited me to Rapid City, South Dakota. And then I was in Rapid City and he called me up and he said, "Hey, Bob, there's this job with this Catholic Health Partners health system in Lima, Ohio. And, I think you ought to take a look." And I was like, I don't know that I'd take a look if it was anybody but you asking, Carson, but I'll take a look. And so long story short, I ended up in Lima and then up here. Well, Carson used to be the vice president of human resources for St. Vincent's. And he still lives here in Toledo. So, it just all kind of came full circle.
Wow. Uh-huh. Where did you grow up?
South Dakota.
South Dakota. Okay. So it's.
Oh yeah, you betcha.
Yeah. No. What is it? Is it very different here compared to South Dakota?
You would be surprised how much the same it is.
Yeah.
How much the same?
The same. Yeah. I feel like, I always thought of South Dakota as the Midwest, and I always thought of like Ohio as the East. And I think Ohio is just like part of the Midwest. Yeah. The people are similar. There's the same sense of friendliness. The climate's very similar. The soil is the same.
Because your parents still live there, right?
They do.
Yeah. Midwest is such a broad range. I always wonder that too, because like we're all the way, because I'm we moved here when I was 3. So basically Ohio is my home, and we're on the very like right of what you would consider, the Midwest, because the Midwest is such a broad ranging thing. But
where did you guys move from?
Rochester, New York. Because that's where Cindy and I did our residencies in Rochester, New York. And so we were there for 7 years, and then we moved back to Toledo.
Okay.
Yeah, it's the only time I really left Toledo was for residency.
So this was always like, to me, this was like Ohio, Indiana, Illinois was the industrial Midwest as opposed to the Midwest. And that was probably just, if you're in Rochester, of course you were Toledoan, but you probably thought of it as West or Midwest.
And I mean, Rochester, the neighborhoods, especially Buffalo, is very similar, I think, to Toledo too, the neighborhoods and things like that.
Buffalo's still doing very well.
Yeah.
I mean, I feel like I know a ton of people from Buffalo they would know like where Rochester is, because just at Ohio State, there's a lot of Buffalo people. It's always, Ohio State just got a ton of people from all over, but I was always surprised by that people would come to Ohio State from Buffalo. There's a lot of, you get a lot of New Jersey people too.
I would say about South Dakota, if you ever go out there, the river bifurcates it, in western South Dakota is very different from eastern South Dakota. I would say once you get to the other side of the Missouri River, then you're kind of in the western United States. It's just, you can feel the difference.
What's the terrain? Is it hilly there? Is there a lot of parks and natural, like?
Eastern side of the state, pretty flat.
Okay.
Pretty flat. Western side of the state, you get some interesting topography. It's a lot more arid. We ran cattle. It takes a lot more acres to graze the same amount of cattle in the western part of the state than it does on the eastern part of the state. You can't really farm in the western part of the state like you can on the eastern part of the state. And then you kind of get to the Black Hills, and then you get to sort of that Dances with Wolves territory.
Is that where Mount Rushmore is, right?
Yeah, Mount Rushmore is out there too.
Yeah, it's definitely a bucket list thing. But no, it's funny. I drove from Toledo, Ohio to Denver, Colorado with my girlfriend in 2022. And it's funny, once you get past like Chicago and then the rest of the way, like you pass Lincoln eventually, but it's just completely like there's nothing going on. It's farmland and all that. And then you get into Colorado and it's weird. And somewhat like that eastern part of Colorado is flat until you get to Denver, and then it's just all you got the mountains.
There's the mountain range right there. It just starts.
Yeah, it just starts, but it's so weird how just from there like over it's basically just farmland, and that's what's going on.
If you ever want to feel like you're the last person on the planet, spend some time in the sandhills of Nebraska, and you will feel it. But
I think another interesting thing would be that I would be interested in is, so as the president of the Toledo Market, and then you said before that the Lima Market, what's like the overarching responsibilities if you're in charge of different markets? Are there certain goals and metrics you're going for, or just kind of what you do and how you would define the success of what you're targeting when you're working that role?
Yeah, I mean, at the end of the day, our measure of success is, have we extended the healing ministry of Christ? And have we been of good help to our communities? So everything we do serves that goal. And that takes a lot of different, perspectives. I mean, one of it is just how do we provide the best patient care we possibly can? That definitely is part of that mission statement. Part of it is how do we engage with our communities, and how do we help support the poor and underserved, not just from a patient standpoint, but from a growing the community standpoint. And, so quality, we can talk about quality measures all day long. And, there's a lot of different ways to look at that. Community standpoint's a little more interesting. I think in our area, infant mortality, especially, in the Cherry Street corridor and kind of what we call the Getting Healthy Zone, that adjacent 3 zip codes, is really something we're focused on with our partners in that space. And there's been a lot of positive impact that, different, I'd like to say us, along with a lot of other players, have had in that space of infant mortality. Financial literacy. And so we have the Financial Opportunity Center. Again, we do all these things with partners to help people improve their credit scores, to be able to get loans, to improve their houses, to be able to get tax refunds, maybe it's to get financing for something else. So that's a big piece of it. Safe housing, and improving the housing stock in the neighborhood. So those are like 3 metrics that we have from that standpoint. And then it also includes what, from the community. How many of our employees come from the community that we're serving? So we want to be very aware of that, because we think people who are in the hospital want to be taken care of by their friends and neighbors and people from the surrounding community and who have shared experiences with them. And it's also part of our commitment. So that's a big piece of it too. Obviously, financially we have to be successful as well. That enables us to do those things, and every dollar we make goes back into our mission somehow. It goes back into serving our communities and serving our patients. So it's often an uncomfortable discussion to have, but I think like when you look around Northwest Ohio and the state of Ohio and across the country, it's an important discussion to have.
Yeah.
So we can maintain those services.
Who sets up the initiatives that you're talking about? I mean, is it committees or?
It's an interesting question. Sometimes the world sets up the initiatives. We were talking about COVID a little bit earlier, and all of a sudden, circumstances on the planet set up our initiatives for us. And, how are we going to deal with supply chain issues and what were delivery times and safety inventory is going to look like, stuff like that.
But do you have specific people that think about the initiatives that you should be doing, or who is it? Like who?
Yeah, for sure. So we'll have initiatives that are quality in nature. So we have a lot of depth within the ministry as to looking at what should be our outcomes for cardiac scores, what should be our outcomes when it comes to C-section rates versus non-C-section rates. What are some orthopedic neurosurgical quality scores we should look at? And then, based on, the challenges within the ministry, the challenges in healthcare across the nation, we'll set some targets. And really most of those right now really reflect chronic disease measures.
Yeah.
Diabetes, blood pressure control, a lot of screening and prevention oriented stuff. And that fits very well within what's important to us, which is value-based healthcare. And that's another conversation we could have. But, the gist of that is, the problem with one of the challenges with healthcare today, and I'm not an apologist for American healthcare. I think American healthcare provides the best healthcare in the world. That's why people come from all over the world to get their care here. Right. But it is no doubt expensive as well. So, how do you balance that cost, quality, and access pyramid? So, one of the challenges is the more we do, the more we get paid. And that's how we, pay for the technology, we pay for the raises, we pay for the equipment, things like that. So being part of changing the payment paradigm so that by focusing on prevention and keeping people well and out of the hospital, we can succeed financially by doing that.
Because we talk about that a lot, as Kevin and I have talked about, is, people come to me for surgery because they've already, had a problem with their back or their brain, or people go to see their primary doctor because they've already got diabetes or they've got high blood pressure. And so we treat them, right? But we need to shift it to prevention, right? How do we stop people from getting these diseases in the first place? And but that comes back to diet and exercising. So we talk about how America, our nation, needs to shift to a different thought of preventing before we get to the point. We just treat people, right? They get the disease and then we treat it, and that's how it's always been. But we need to get to the point where we prevent it so they don't need treatment.
Yeah. Oh, go ahead.
Yeah. No, there's Malcolm Gladwell uses this great metaphor. He talks about, when the bridge collapses, we're wonderful at bringing in all sorts of resources to repair the bridge in record time. But the study that said this bridge is going to collapse in 5 years unless we spend a fraction of that amount of money gets ignored. There's similar things in healthcare. The heroic efforts when somebody has a catastrophic event are bar none exceptional, best in the world, but we don't put the effort into the prevention as much as we probably should and could.
Well, the thing is too, I think a huge thing is in health, money, lots of different areas, humans are very rational. It's not like they're making from it. If you look at it as a very generalized thing, a population, it's hard to, it may something a certain subpopulation is doing looks illogical, but when you look at the personal situations, it's not. Why are people eating fast food or other things? They don't have time. It's cheaper to eat that, and you don't get any type of kickback if you eat healthy and all that stuff, even though you might cause a huge strain on the healthcare system in the future. So that's what we talk about, is how do you get people, eating healthier, taking steps, exercising.
And we can go to rallies and get 2 hamburgers for $4, but a thing of blueberries costs $5. How do you can see why people eat junk food, because it's so cheap, but it's not good for them.
Yeah.
But it's the way we're set up right now. I mean,
go get some fresh vegetables, and if you haven't eaten them in 3 days, you got to throw them out.
Right.
Yeah.
Yeah. Exactly.
Yeah. Well, and it's if you're busy, especially if you and your significant other as a couple, if you both are working, it's very hard to want after a long day of work to come home. I know with my girlfriend, sometimes you come home after you've both been working all day and you don't feel like cooking for an hour or something. Right. It definitely takes more time as well. So I think it's very easy, just like with a lot of things, to say like, oh, healthcare is broken, blah, blah, blah. But it does very well, like you were saying, at treating the things it can. But there's also a lot of other areas that people just overlook. It's not just, there's a lot of nuances to things.
Yeah, I mean.
But in your mind, how do you change that? So how do you start to incentivize people, or do you have to subsidize people? How do you change it? Like, what's your thoughts on changing this? So how do we get to more preventative medicine as opposed to after the fact treatment?
Mm-hmm. Well, certainly we haven't, solved that Rubik's Cube yet. I don't think anybody has. But it's, one of the things we've done, or kind of where we've focused our efforts, is, looking at 5 or 6 measures that seem to have the biggest outcome related to long-term care. So again, it's the high blood pressures and the A1Cs and, things like that, the screenings, the vaccinations, all that stuff. And then we're going at risk with Medicare, or we're going at risk with Medicaid or the Medicare Advantage companies to say, if we reduce your cost of care while keeping quality very high, so let's agree to some quality standards, we would like to share that savings with you.
Right.
So, that's sort of the economic model. Mm-hmm. Then a lot of the onus on that, goes to the physician's office, especially the primary care office, to, have those conversations with patients, make sure they're getting their annual wellness exams, that they leave with their blood pressure under control. And then it's also trying to do things to support our patients outside the physician's office, because, as you know better than I do, 99.9999% of a person's life is spent outside of a physician's office. Right. So we've got to impact them in their decision making there, not just in that between the 4 walls.
Yeah.
I think one thing that's, it's very buzzy the last couple of years, but with, artificial intelligence and AI, have you started seeing anything with like applications or other thing, or like long-term planning? I would say like strategic planning, because that's obviously it's impacting everything around it. Healthcare usually lags a little bit with technological advancement, I feel like, but
yeah, I think this is like the blue ocean. This is like a really exciting topic. And I know everyone talks about AI, and I don't even know, between an algorithm and AI, it sort of all gets messed up. But what I see today in terms of like, I'll just call it like AI technology, is like more of a focus on trying to ease some of the administrative burden and waste that goes on. So a lot of it is on the submitting bills and payment of bills and processing and all that. It's important. It has the potential of reducing, that administrative waste that goes on in healthcare. So reducing the cost of care to the country overall. It's not the fun and exciting part of it, but it's important. But even just last week, we had an AI company come in and demo their passive listening device for physician offices to be able to do the documentation for the physician's office. And then as it listens passively, it's documenting, and then it makes suggestions related to the coding based on that. And so, you talk about...
That's interesting.
How exciting, to maybe think that the next generation of physicians won't have the same burnout attributed to EMR activities as today's physicians do, right? So they're actually, the same company had a demo for us that we took a peek at for inpatient nursing to help with nursing documentation, as well as for the emergency department. So we're just kind of getting our feet wet in some of that space. There's a ton of stuff going on like the supply chain side too, and anticipating demand and automating the order process, and just making it less error prone, less manual, things like that. But it's just a plethora of different applications that are coming out. And my guess is that 99% of them won't be around in 2 years, but the ones that stick could be hugely impactful.
Well, he spoke at a healthcare conference about like social media and medicine last November. And there's also a presentation on AI. And that's what it sounds like, not just in healthcare, but a lot of fields. there's some things that are like kind of quote unquote sexy, like the AI, if they could do this, but I don't think it's so much that. I think it's a lot of the other stuff where, they can do, AI does some stuff really well, like documentation could be a great example. It frees people up then to do stuff that humans can do well. So it's just like with a lot of technology doesn't completely replace necessarily, but it allows humans to do more, or, you enhance through that with the augmentation of it being implemented, which is pretty cool. And you probably get to see a lot of cool potential things, because I'm sure the pitches are always, the best of the best with what they say they can do. But
they all start out saying they're AI, whether they are or aren't. But I'd be curious if you could like wave the magic wand tomorrow and there was an AI application that could decrease pain for some part of your practice life. Where would you like to see it?
Decrease the pain?
Yeah, the friction point or the pain, or
I don't know. For me, it's just computers. I mean, because I don't like working at computers, and I don't mind dictating, but if I had something that would interpret what I'm saying, and that does free up time, more time I can spend with the patient. Because right now what's happened with doctors is, we have to order our own test and put in the order on the computer, or I have to order physical therapy. I have to dictate my note. All the clerical things I have to do on the computer takes away for the time that I can spend with the patients. And to me, it seems like a waste of my time after all the education I've gone through, that I have to put in an order for an MRI or an order for a chest x-ray. It just takes up time. So if I could have AI do that for me, I mean, that would save so much time that I could spend with patients or doing other things. So that's probably the biggest thing I would say.
Go ahead.
Oh, isn't the thing with why it shifted more towards that is like with insurance companies and all that. So yeah, if they could implement AI that's like checking all that stuff, so you could do less of that you could free it up. Because like you probably feel like there's only you can go see your patients, like, and really, that's only you can do, but there's definitely more people that can do documentation and order stuff.
There is, but it's been put on our shoulders, and I don't know why. It's a recent thing over the past year or two, but I don't know why the doctors have to do all this stuff now, and you can't let the other people in the office who used to do it. But it must be insurance driven, I would imagine, somehow.
But if anyone's listening, that's a good. You're hearing a real physician's pain points as a neurosurgeon.
You got some venture capital money you're willing to put towards that to the right listener.
No, but I think that's the interesting thing is like if that's how all the people that I feel like start great stuff, they just listen to different people, and there's probably so many like nurses or other healthcare workers coming up with cool stuff right now that it's stuff like that you wouldn't even know, but like that's. Some people probably would have no idea that surgeons spend any of their time doing that. But
well, and there's an error too, right? Because you're human, right? So if you're busy seeing patients, and then you got to go back in really quick and put this order and stuff, you're gonna, what if you pick a cervical MRI instead of the thoracic MRI? Hit the wrong box because you're hurrying. Then that's a cost to the healthcare system because somebody's got to pay for that wrong test. So I mean, it would be so beneficial to figure out some intelligence that could do that accurately for us. It would be better for patient care. It would probably be cost effective. More time can be spent with the patient. So yeah, that's a good thought.
I don't know if it feels this way to you. One of the things I hear about frequently from physicians is that they feel like they're taking the history and physical of the computer rather than the patient because they're looking at the computer screen, the Epic screen all the time. I mean, just think if you could have the passive listening and it works for you and you're back looking eye to eye at the patient at that point.
Yeah, and I don't do that. I don't have a computer in the room when I see patients, but I hear patients complain when they go to see their doctor that they're not even paying attention to me, and that's a big complaint you hear about.
Yeah.
Well, I think,
but it's probably a necessity for other specialties. Maybe it's a necessity to do that. I don't know.
I think it's always too. I think that's something you do very well, but it's another thing about you have to learn all these skills as a doctor. The biggest thing that a lot of patients, they care about the most is bedside manner in terms of how you talk to someone. If you're just looking at something, because a lot of times you can tell pretty early on if someone needs surgery or not. Then it's answering all their questions, making them feel comfortable with stuff and letting them make their own decision. Because I don't think anyone ever likes in any field when you just talk about things in super medical terms or higher level terms versus layman's terms. People want to understand what you're talking about, not just be told, hey, you need this done. So I mean, that's another thing I think where AI will probably do well in terms of if a pass and listen device, if it can make a post-op thing too from the patient of everything they talked about. I talked to so many different people who have gone, not necessarily for surgery, I'm a little younger, but just people talking about different medical things. They forget, I can't remember quite what the doctor said, and then maybe they're just misremembering different things.
Yeah.
Well, and I've seen enough of your videos and TikToks. You're very approachable. You put it in language where people can understand what they're being told. You're not trying to overly complicate it. And I don't think people try to do that on purpose. I think they just use the language they've been indoctrinated with for years and years and years. It just rolls off their tongue. And I think you have to be somewhat purposeful and take a step back.
It'd be cool, I think, if you could have, artificial intelligence or robot, whatever you want to call it, but after you're done seeing the patient, if the patient had no idea what you said to them because you didn't explain it well or your language was too above their head, have an AI that after the visit you can sit down with for 3 minutes and will summarize what the doctor said to you in their terms. Yeah. And then every patient, does she move to the next room and you got a little robot or whoever there explaining what was just said to you. This is what he really is talking about. It'd be kind of cool.
Well, I think that's what AI is much more capable of right now is you can put in super complex stuff and say, hey, put this back to me like I'm a fifth grader
right?
Who knows nothing about medicine.
Yeah. That's that would be a cool idea. Really and then it's reiterated them right after their visit in a separate room. It's not going to, take up anybody's time.
All right, Bob, you gotta get Mercy on this.
Well, I was going to say, that's not science fiction at all. I've got like some services I subscribe to, and the first paragraph that summarizes the article says the summary has been prepared by AI and reviewed by a human for accuracy. And I mean, what you're talking about is just an iteration away from doing that. Liability issues will be.
Well, I don't think that sounds like that. It sounds cool, but to you, it probably sounds very cool. For other people, that's such a, like you were saying, that's such a small portion of their life. So it doesn't seem groundbreaking, but the amount of patients that are in every day. And that's where I think AI will have huge implications of like people. I don't think it's always where people think it's going to be. I think people are all like, where are self-driving cars and where are these humanoid robots?
Where are the flying skateboards? Aren't we supposed to have the skateboards by now?
They're coming. Back to the Future?
Yeah.
Aren't even fly?
We're past that.
Oh, that's right. Yeah.
I always wonder when they're making movies, like those are the things that come to people's heads. Like we have so much crazier stuff that's probably crazier than that. Then there's stuff like that. Or I love looking at Star Wars, the flying cars. Those look so cool. But yeah.
Another thing I wanted to ask you about, I think is kind of fascinating is, so I think there's a lot of turnover for nursing and stuff in healthcare systems, and a lot of positions there's turnover. And part of that can be monetary. Part of that is just philosophy. Maybe they don't like the philosophy of the place, but you're in a position that you're in charge of a lot of people, being the president. And how do you motivate people? How do you inspire people? Do you have to set the pace, or do you have teams that set the pace? Like how? But it has to come from top down. So how do you organize that to keep your people who work for you and your healthcare system motivated, inspired, want to come to work? Like you said, don't dread their job. Don't, like you said earlier that you dreaded that one job. How do you get people not to be in that position as a healthcare system? I
think the first thing is, you get the right people on board. So get the right people on board. Yeah. I mean, where we're really blessed is we have an amazing team, and, they're all high achieving, extraordinarily committed, very intelligent, and collaborate well with others. And, you don't automatically have that. At these levels, it's always smart people, but do they work and play well together is a completely different question. They may all be really talented and smart, but they may not work together well. So I think the first thing for us is, do we have the right team? That takes a little bit of spice, a little bit of sugar, a little bit of broth. They can't be all carbon copies of each other. So, just having the right team and being purposeful about putting that together has been a huge part. And they all want to achieve goals. They all are very committed to the mission and what it is we seek to accomplish as ministry. So I think, my role is to help create a shared vision, and that's a collaborative process. That's a collaborative exercise. But, hopefully if everybody sees the same information, sees the same things, that they'll come to more or less the same conclusion about what it is we ought to be doing. And then, once you kind of have that shared vision, I forget there's a saying out there, something to the effect, vision without execution is hallucination or a nightmare or something like that. And execution without a vision is chaos, so what we try to do is marry the two up. So, from that point, if you can create a vision, you can create alignment around that vision. And I sort of view my role a little bit of a conductor. I can't do the jobs of so many of the people that I work with, but, understanding what they what they're able to do, what their strengths are, and try and move everybody in the same pace, the same cadence, in the same direction is a big part of my role. And then, honestly, there's an accountability piece to it too, because you're only as strong as, the slowest person on the team, so to speak, or the least committed on the team. So making sure that we have accountability around what we've all said we want to do and is important to do has been a big part of it. But, we don't struggle with it. I mean, people just kind of naturally, either self-select out if they're not the right people for the role, and we haven't had that for a very long time, or they go at a pace that I can't possibly keep up with, and you just let them run.
Well, the hospital I operate today, it's a hospital Mercy Health system. But I can say the surgery department is such a how do I want to put it? There's such a community. Like it's everybody works together and they're all happy and they know each other and they're always, it's just like a little community that works together. That's how I would put it. It's not like everybody has their own role, but then it's like one big community where they all interact, and it's like, it's pretty cool to see. I mean, everybody seems happy. They're always nice. Everybody says hi. There's never anybody that's grumpy that I see. Everybody just works together. It's one of the best departments I've seen that just all works together. It's not like one or two outliers who are off doing their own thing and they're unhappy. You know what I'm saying? It's not like that. It's pretty cool.
And I think,
you don't always see that. You don't always see that. Yeah, it's a self-sustaining environment, exactly. Yeah. But it's probably the right people, the right mindset. They all have a mindset to work together, to enjoy what they're doing. They really work towards the patient care and making the best experience for the patient. And you can see they all have that on their mind. And maybe that sets the tone for everybody to interact the way they do. I don't know, but it's really a neat experience when I walk in. And it always, when you walk in the morning, you might be tired coming in, you just got up and stuff, but it just brightens your day right away because everybody's happy and interacting and working for the patient. It's really cool.
Well, and you've seen enough environments, and surgery is, of course, its own special area.
I've seen horrible environments where no one's happy. Yeah. So it's
you don't take it for granted, right?
No.
Well, I think it's always good. Like the sports analogy is always the easiest. You don't need all the best players. You need people that have really good chemistry or are enjoying working together, working towards a shared purpose or a shared goal.
Yeah.
So I feel like that's when you probably have, better outcomes.
100%.
100%.
Yeah. Did you have anything else? I want to shift topics and then. I did want to ask you because COVID was such a massive thing.
I thought we weren't going to talk about that. I was assured I wouldn't have to do math.
We were talking a little about it before we started recording, but I thought that was.
Do you want your N95 mask for the sport?
No, but not only just working through it and all of the impact there and what that was like, but also what has been learned and how have things changed. In terms of strategy wise or things you learned during such a kind of, thrown into the fire, so to say.
Yeah. There's so much, it's hard to know where even to start. I mean, it's hard to imagine an aspect of, what we do in our roles that wasn't impacted in some way by COVID. I guess what we talk a lot about because it was so significant is, the impact on people, right? And we all know the stories. I don't want to go back through the stories about, caregivers going home, not knowing if they could go back into the house with their family and things like that. I mean, those things were real. If you think about strategy as an example, we've always said people are our most important asset, and it's absolutely true. Always been true. And it's like, okay, we've got people as our most important asset, then we're going to do this thing and then this other thing. We got to work on capital. I mean, what COVID really highlighted is priority 1, priority 2, and priority 3 is people, people, people. And priority 4 doesn't matter because we got to take care of priority 1, 2, and 3. So that was, lesson number 1. And frankly, we're still kind of dealing with the after effects of that today, whether it's some of the workplace violence issues that came up, that somehow became more socially acceptable during that time frame, as people were in difficult situations and didn't know if they could see their family members and things like that. But we still have a tail on some of the workplace violence issues and the discomfort that comes from that. Recruitment and retention. I mean, in healthcare in general, a lot of nurses don't make it past their first year or 2 years because the environment always isn't always as supportive as you'd want it to be for, people to say. I mean, it's a profession that kind of eats their young, because they demand a high level of performance right out of the gates, and people need to learn. And so you sort of understand both sides of that, but it doesn't help us long term if we can't retain those people. I saw a study that said, over, between now and 2028, we're going to lose 800,000 nurses from the workforce, which dwarfs the number of nurses that we lost. And it's not just nurses, but that's the thing that's easiest to talk about.
Yeah.
That dwarfs the number of nurses
we lost a lot of
COVID.
Seasoned nurses. Our old seasoned nurses who would train and inspire the younger people are all gone. I mean, they're just gone.
There's definitely a experience penalty that I think healthcare is paying, to your point. But it's also, we talked about JA a little bit earlier, but I think it's also caused us to be more strategic about, instead of post and pray, we'll find people and things like that, to think more deeply about, not only high schoolers, but middle schoolers, exposing people to careers in healthcare, some of it clinical, some of it ancillary, some of it facilities, some of it executive or support services, things like that. We just did a thing announced a program with Toledo Public Schools where they're bringing their Health Science Academy into our Mercy College building. And hopefully that will create a pathway for students who want to get into healthcare and make it more accessible to them. And, whether they come to us or they go to someone else, that'll be, better resources for the community. So it's caused us to think more deeply about that. Another thing was just supply chain. I think a lot of us took supply chain for granted.
That's why I was the most interested with the question, because I feel like that was the huge thing and across the world of just all of a sudden that's shut down and not being able to get life-saving masks. That was the biggest thing at first, and that I feel like that's just like an eye-opener. You never expect the worst thing to happen, but that's why it's always worth having fail-safes in place almost.
Yeah, I mean, this is you remember Black Swan events, things that, I get this magazine, and every year at the beginning of the year, looks at the year ahead, and it never has it right. The things that are really impact the year are things that nobody predicted. It's these Black Swan sort of events.
Black Swans inherently, it's that's the funny part when people try to predict a Black Swan. It's inherently you can't predict it. It's the unpredictable. It's 9/11. It's COVID. It's all stuff like that, which is just, you never in your right mind be thinking of those things.
Yeah. And so it's like with supply chain, I think it's an interesting conversation to say, okay, do we onshore everything? Because, we paid a penalty by offshoring a lot of stuff. But at the same time, actually the market responded, given the shock that everyone experienced, responded pretty well. So, what's that balance? And I don't know the answer, but what's the balance of onshoring of things that we absolutely have to have domestic production available for versus things that can be offshored and, there's competitive advantages. And, there were people who did think about this stuff, but it didn't capture, I think, the totality of, the healthcare continuum to really kind of think deeply about those things. When you start thinking about how many masks can you get on a plane, fly over the Pacific and get to the United States versus a cargo ship, it's an entirely different discussion.
Yeah.
Well, it's just so hard to plan for stuff too. And no matter what, like you're saying, even because what if that doesn't happen for 50 years and then you're just keeping everything stored? Or I know masks go bad and stuff too. Yeah. So it's interesting.
There was a moment where a friend of mine said, "Nobody's coming to save you," and that just dropped like a lead balloon, because it's there's a tornado or something, everybody platoons resources in, and if there's a hurricane that hits Houston, we all bring resources. Right. There's nobody come to save any of us. We all just had to figure it out.
Right.
And I really feel for the smaller hospitals and the smaller health systems. We're fortunate enough that we had enough size and breadth and depth, that we could kind of get near the front of the line on some of those critical supply items. Mm-hmm. But if you're a small independent hospital, where do you go? You just don't have the clout to pull that through.
Is Mercy the oldest health system in Toledo?
I'm going to say yes, though I should probably double check myself.
Well, I don't know, ProMedica, Toledo Hospital's around for a long time, but I don't know if it was ProMedica Health System. Right?
So we're 168 years.
168?
Oh, wow.
Yeah.
Wow.
So I think we're the oldest. I looked at it once. So I will say I consulted, my crack research team consulted Google, which was me. And I looked for the oldest businesses in Toledo. Yeah. And Buckeye Beer, from what I could find, is the oldest business in Toledo. And then if you think of us as a business, I think we're the second oldest from what I could find. So if somebody finds something else, they could prove me wrong.
But that's interesting.
I wonder where Hefflinger Funeral Home is. Well, it was started in 1875, I think. So I wonder, it's pretty old.
Wait, another thing, or what were you gonna ask?
No,
Because something that.
But I mean, it's an old, like, I know like the nursing program's really old, because my grandmother, who would be 110 now or something, she went to nursing school at Mercy.
Okay.
And so that was probably back in the 20s, I would imagine.
I didn't realize Mercy was that old.
Yeah, I mean, isn't that crazy?
So you have a family funeral home? I didn't know it.
Well, so my great grandfather moved from Germany, and he started Hefflinger Funeral Home on the east side, I believe, in 1875.
Okay.
So that business, well, yeah, that it's been sold off, so it's not really Hefflinger Funeral Home anymore. But
Hefflinger Bolander still? Or is it just Bolander?
I got sold off to a chain because everybody died. None of us kids went into it, but.
Glad you moved upstream in that business.
That's fun.
But it is an old business. Like they have a book of Toledo businesses in Toledo, like original businesses in Toledo, and Hefflinger's got like 2 or 3 pages.
Well,
in there.
Before he came from Germany, wasn't he like a cabinet maker?
He's a cabinet maker, and when he came over here, he thought he made cabinets here and then changed to coffins, right? And then his wife Suzanne, they had 9 children. So then she eventually, 2 or 3 years after he established himself here, Suzanne, his wife, moved over here with 9 children.
Wow.
And my grandfather was the youngest of 9. I think 3 of the kids died from influenza in the early 20s. So they lost 3 of their children to influenza, and 2 other of them died young. I think 1 drowned. But it's amazing the life expectancy back then. How many out of 9 kids, only really 3 or 4 survived any amount of time.
People don't understand life expectancy's gone up so much, not because people are living longer necessarily, in terms of the oldest people get is still like 100's very old, and we haven't really got past that. But we've gotten, with modern medicine, solved so much of like the early infancy
deaths, right? The early
and
deaths,
like the first 10 years of your life. That's where I feel like life expectancy's numbers. It's not like people are just. If you got past that, there's still people that like hundreds of years ago that would live to 80 or 90.
I mean, it would be interesting to know numbers of COVID versus like influenza. I mean, there's probably no comparison, but I know I'm saying that's what killed. Look at it, 3 of my, grandfather's family siblings died from influenza.
What was it? The bubonic plague? Like, that's where we're super lucky with COVID, is that it wasn't super.
Well, that was like what 40% of the world.
Like 25% of the population died.
Yeah, it's crazy.
But I'm saying that's because COVID spread so much. So many people got COVID, but with stuff we had, like a ton of people didn't die. It was more so older people or people who were compromised. But it is, so it's crazy to think if we had something like that, where I don't know what that would even be like with how people would think about it.
I think we will someday. I think there's going to be a virus or something that happens that's going to. It'll happen. There's too many things out there, or genetically engineered ththings that are going to be used. You watch. I think it's going to wipe out a lot of our population because it's going to happen. I mean, just like with the antibiotics. I mean, there are so many bacteria becoming resistant to every antibiotic we have. So when a bacteria finally morphs into something where no antibiotic works and it spreads like wildfire, what are you going to do? I mean, people are going to die. I mean, you're going to have another plague on your hands, and I think it's going to happen no matter how smart we are. Bacteria and evolution are smart too. I mean,
so I can be a bit of a tech optimist at times. So we were talking about AI earlier, and there was a AI LLM, whatever it was, that predicted every protein fold that I'm not a scientist, right? But it, as scientists tried to look at different proteins and how they fold, it's a very difficult 3-dimensional sort of exercise, and they put a AI towards it. And it predicted, every protein that we know of, plus like a whole bunch more. Oh. And so it's like expanding the frontier of what science can look like. And there's been at least some predictions, that this will accelerate development of new drugs by, years, if not decades. Drugs we never would have thought of, because we have this powerful new tool to throw at it, and then accelerate the time frame to go from phase 1 to phase 4 trials. So, because I don't disagree, the tools we have are going to be, ineffective with time. But I'm hopeful, we talk about what could be, new with technology.
Well, the future holds so much. Like we're on social media quite a bit, and we had a company contact us. Kevin can tell you more about it, but it's a screening exam that really will look at your genes.
Well, completely sequences your genome, and what, like 20 years ago, that would be millions of dollars, and now you can do it for about $400.
And it'll give you your likelihood of you're going to develop this or that, or so
it's not the only company, I don't think, but that's a huge next step. I've looked a lot in that the last couple of years. When you think about all the stuff, it's the huge next step is definitely, or another huge step is definitely sequencing genomes, and then when you can do that at an individual level, in where the price point's actually that a majority of people can get it. Yeah. There's so many things that, it's not fair, but genes make up such a huge thing. Like if you have a family history of stuff where it can say like you're much more likely to have this, like this heart problem or this or that, you can actively work to prevent that with diet and exercise.
Or if you smoke, that gene's more likely to be turned on because you have that gene and you're much more likely to get cancer. So it might help people think not to smoke. Like I have a 90% chance of getting cancer if I smoke.
It's hard to bury your head in the sand too. If you see right in front of you, like, hey, you have a high risk of this. Right. Like you should, if you just never get tested, I think some people do that. If you never get tested for anything, then you don't know, like, is this going to hurt me or not? So
well, I think I saw there was, they actually did gene editing for sickle cell, right?
Yeah.
Actually,
they cured a cure.
Yeah, they cured actually a cure.
It's pretty cool.
I mean, so when you start thinking, the potential of that sort of technology, I mean, there are things that we never were able to address.
I mean, they're going to cure cancer for sure, I think. I mean, I just think it's going to take time with all the sequencing that goes on and viruses that they can, put in your body to kill tumor cells. I mean, I think it's going to happen.
Yeah. Well,
can you imagine all the
I think a lot of things, it's just like, it's more of a time, it's kind of more of an, like a when, not if. Right. Like a lot, I'm saying we've made, in different fields, we've made so much progress in so many areas. There, in a lot of these fields, there's usually huge breakthroughs. It's not like super linear. It's like kind of, you jump up, you make huge advancements. Someone finds something, they apply something from another field. Yeah. So, but it's pretty cool. Before you go, the other thing I wanted to talk about to finish it up was we're talking about healthcare and all that, but me and my dad both to run. I think you've got us both beat. I know we're starting with that, but you love to run. I kind of wanted to talk to you a little bit about kind of when you started running, how you got into that, and I know you've run, I don't know how many marathons have you run?
Probably about 28, 29.
Yeah, that's only
insane. Only 29.
But what's your current? You were telling us before we started recording. What's your current goal? Is all 50 states, right?
I don't know if I'll ever get it done, but yeah, I would like to run all 50 states. It's just a great way to see the country.
So where are you going to do your one in Alaska?
I've got to figure that one out yet. I'm sure it'll probably be around Anchorage or something. Yeah. I'm not going to try and do anything crazy.
There's probably a cool one there.
There's probably some really great trail runs out there that you could do. You
got to make sure you don't run into any bears.
That's the thing, yeah. But city streets and flat surfaces, I'm all about that.
You're on you've done 6 so far?
6
out of the 50.
Yeah. Actually, maybe a few 9 more, maybe like 8 or 9.
Oh, sorry,
yeah.
8 or 9. Okay,
that's all right. I mean, don't make it any harder on me than it already is.
Oh no, 8 or 9. I mean, that's you're well on your way. I'm surprised that you didn't. You've done.
Come
20,
join me, you guys. Can,
maybe
you guys run marathons. You can do 50
he does now.
But yeah, no. Bob actually started the Mercy. Glass City Marathon. Mercy's the sponsor of the Glass City Marathon here in Toledo. So I did it last year, 2023. It's usually it's like the third week of April, like 25th around there. Bob was the announcer right before. You had a little talk for a couple minutes before.
Yeah, I got to welcome the crowd.
You got to welcome the crowd. Really cool. And my dad told me after, I was like, I wasn't sure if you had run it. And he's like, no, he ran it too. So you must have run down right after you talked.
Well, it's a big marathon, isn't it? I hear about bits and pieces, but isn't it like a super long standing marathon? It's one of the biggest marathons.
It's a big one, and I've forgotten the exact.
I mean, not big in like numbers, not like the New York City,
but it's a massive Boston. It's a top 10 for Boston qualifying because it's more so flat.
Yeah. Right? I was in Knoxville a couple months ago. Okay, confession time. It was the same weekend as the Mercy Health Glass City Marathon, but I needed to add a state, so I was in Tennessee. I'm at the booth, and they're like. They see my Toledo shirt on. They're like, "Why aren't you running the Mercy Health Glass City Marathon?" So in Knoxville, they know about the Glass City Marathon.
That's fun. But so, how long have you been running for? When did you start running?
It was probably around 2010 or something. I used to be a much bigger guy, so I needed to do some things, get a little bit healthier.
So not your whole life.
Not my whole life. No, it's probably the only reason I still have my knees is I started later. But yeah, I just needed to do some things to these roles, I mean, they're wonderful roles, but if you let yourself, you can sit all day and be sedentary and, eat big meals and, it's not good for your lifestyle.
You're another person too, where people, sometimes they say, I don't have enough time to do this and that. But I mean, look at somebody like you who's busy all day. I know your schedule because I try to get hold of you in meetings constantly. Early morning to late afternoon and in evening and dinner meetings. And, where do you find the time to work it in? But you do, obviously, and you do marathons routinely. And
do you like to work out in the mornings or at night or just when you can?
I'm very atypical. It's I'm more of a nights sort of person. So it's
that's how I think, just whenever you can, kind of.
Yeah, I know. I admire the folks who are larks and can get up at 4:30 in the morning and get their run in and read the paper and a cup of coffee before work. I can't do that.
So I got to ask, I'm sure it's going to be, what's your personal best marathon time?
It's 3:13.
Wow.
That's awesome.
That's huge.
So you run Boston before?
I have run Boston.
Okay. Yeah.
Wow. It was an awesome experience. Yeah. I was on the one bus that got lost. Yeah. It's like, man, this could be a long run because we've been on this bus for a long time and our bus driver had missed the exit. And so I almost missed my starting time, but made for a good start.
So do they bus you from a certain area to the start line?
Yeah, they bus you from downtown. It's a point-to-point run. So they bus you from downtown Boston to the start of the marathon in Chelsea, wherever it is.
That's right. I didn't know.
So that counts as your Massachusetts marathon. Okay, that's
for sure.
State, Have you done it multiple times or just once?
Just once.
Okay, once. But I'm assuming you've probably qualified for it.
I have, honestly. So here's the thing. I had such an awesome time out there. I never want to go again and mess with the memory of it. It was I don't want it to be like, was it that one or that one? Yeah, when people ask me about running, I mean, it's like, I'm not really an athlete. It's just, it's just about taking time. I mean, it's just training,
and endurance.
I think too, I mean, that shows there's such a lot, there's so many flavors to running and exercising and stuff. There's some people that they just want to get the best times or do this or that or compare it. But some people, for you, it's a fun thing to do. I think about that too. It gives you gives you an excuse to travel. I think with any of these things, gives you an excuse to travel, and it's kind of fun to do. It takes up time and it's healthy.
You should do the Las Vegas rock and roll one. That sounds like a fun one.
Yeah. All right.
I don't know when it is. I'm just saying, a lot of people I've talked to.
When are you doing your next marathon?
I don't know. I got to set a goal on that. Well, you have to commit. Like for me, I have to commit. Like a marathon, I'd have to train a while. So I mean, I'm out of shape here.
I just, people put such pressure on themselves, when they run a marathon. It's like, oh, I'm not going to finish fast, or it's like nobody cares. You just go out there to have fun.
Only you care. That's what when people who first start, like when I do stuff, people who first start, everyone's like, oh, running sucks, this and that. I'm like, you're running way too fast all the time. Like you should be running, like you should not be running as fast as you can every single day. That's injury, and that's how you don't have fun. Like 80-90% of the runs are just easy. But I think that's the most important part is if you just compete against yourself, or you just shift your mindset of like, I need to do this. It's like, no, I get to do this. For me, running decompresses, and just exercising it, oh my God, it frees my mind up, especially when I can run outside. If you're doing stuff at a computer or you're in meetings, it really, I don't know, it's a de-stressing thing, and it clears your mind, I think.
I mean, we were talking about, health and wellness before. Is like the secret to health and wellness isn't a secret. I mean, we all know, get 30 minutes of exercise, get 7 or 8 hours sleep, eat right, de-stress, and socialize. Have friends. And if you can do those things, you're probably going to be, have a higher quality of life, if not, So, for me, that checks several of those boxes. And, I think, whether it's that or something else, if people can find things that help them do that, you got to find a better spot.
It's just like people who are always going to beat you in work. If you find something you like, if you're doing something you hate versus someone who loves doing it, you're always going to get outworked because they enjoy doing it. If you can find things that you like doing, for some people it's yoga, for some people it's running. You don't need to do anyone else's agenda. You just do something. And I don't know, I think that's, and another thing when you were saying is we know the things we need to do for like a lot of areas in life. It's just doing those like quote unquote boring things consistently, with saving and investing money, with eating healthy, with, getting exercise. But we all want to go, here's the new diet that you need to try, like to, be like carbs are out, proteins in, or vice versa. And it's like, that's not what you need to do. You just need to eat consistently well.
Or Ozempic's in one of those.
I know. I started seeing that. I was asking my mom and dad. I was like, I started seeing it on social media. I was like, what's going on? I was like, so if someone found Ozempic, but that'll be a conversation for another time.
For sure.
But thank you so much for coming on. It was a great time talking with you. And
I think too, if I could just ask you one thing, just put you on the spot, but you've reached a level in life that a lot of people probably aspire to, and what would be your bit of advice to somebody out there who's young, who maybe wants to be in a position like you? What would be your advice to somebody like that, just starting out? Like, what's the one thing you think in your life that really got you through to become who you are and where you are? Yeah. It could be anything, and then whatever you think it is in your life. That
I think reflecting on my life, that experience of sort of failing career-wise, that caused me to be introspective. I mean, I'm not necessarily the person to say, make your hobby your living, because it's got to pay too, right? We've all got bills and responsibilities. Yeah. But find something that you enjoy, that you're willing to commit your time to, and you kind of get in the flow of. And if, it doesn't have to be your favorite hobby, but something that you're willing to commit to that makes you feel good about what you're doing and what you do. And then find a mentor to help support you with that. I think, if you can accomplish those two things, that'll take you a long way.
Yeah, I think that's really good advice.
I do too.
Yeah.
I think there needs to be like a sense of purpose and enjoyment is definitely huge. And just like any area, just if you just first started running, getting a coach or seeing people who have done it in your career, I think mentors, but I mean, it's a huge aspect of trying to, you get to kind of, they've got tons of experience. You don't want to, it's basically what you do, what surgeons do is they train.
Yeah. When you're a resident, your attendings are your mentors, and you really learn from them, and hopefully you have a good mentor, which I did. But yeah, I think it's huge. And there's always different stages in life. We have mentors. I remember when I worked at a gas station, and the guy who owned the gas station, he's probably one of the biggest mentors in my life, because he taught me responsibility, and he gave me trust and responsibility. And, he's like a second dad to me almost. But it's people, there's certain people in your life that make a difference in your life for sure. And they shape who you are.
Yeah.
Like you said earlier, we can end on that. I think it's an African proverb, but if you want to go far, go together. If you want to go fast, go alone. And I think that just comes up so many times in life. There's not really anything you can do. Whenever you think someone's doing a bunch of stuff by themselves, they're usually not. It's usually a team effort. True. You just don't see all the behind the scenes team effort. Yeah. I think we were talking about that is in surgery. Surgery is such a team effort, but people just think about the surgeon. So, and all the schedulers, the behind the scenes people who make the hospital operate, the team. So, but I thought that was a great conversation. Yeah. Really appreciate having you on.
Yeah. Thanks for having me. It was a pleasure. I enjoyed it.
All right. We'll talk to you later, guys.
All right.